Western Cape Health Department says its campaign on behavioural changes is crucial in the fight against COVID-19. Officials are targeting some of the province's hotspots with the aim of getting communities to adhere to wearing masks and social distancing. Communities are also being urged to use government isolation and quarantine facilities set up for those infected with COVID-19. Provincial Health MEC Nomafrench Mbombo is visiting Mitchell's Plain today to assess that community's adherence to lockdown regulations. Our colleague Mariska Botha is on that story. Let's cross live to her now. Mariska, a very good morning to you. What's happening where you are?
Well, you can see I'm frowning because as we arrived here in Hines Park in Mitchell's Plain, there was absolutely nobody here wearing a mask or adhering to social distancing. So let me maybe just put you in the loop as to what it looks like here on the ground in the Western Cape at the moment. We have just under 84,000 confirmed COVID-19 cases. This is, of course, as of late yesterday. But of that number, 68,000 people have recovered, and there's 13,300 active cases in the province. Now, while the Western Cape doesn't have the highest infection rate anymore, it doesn't mean that things cannot change overnight. And certainly, along with that goes behavioural change. And that is exactly the message that the Department of Health in the province wants to drive home. You would think 4 months into the lockdown and all the messaging and word that has gone out about COVID-19, people would have done the behavioural change already, but we're simply not seeing it on the ground. For example, a few Sundays ago when the President addressed us, he said there's no excuse anymore for not wearing a mask because it can be made from a simple piece of cloth folded 3 times over. Today, the MEC for Health, Nomafrench and Mbombo, is with us, and she did a walkabout here in Hines Park, and they handed over around 750 masks to community members here. Let's just get a sense from her as to what she thinks about what's happening on the ground. MEC, always a pleasure to speak to you. Thank you for joining us this morning. First of all, talk to us about this outreach program of yours.
Indeed, it is about behavioral change. As we say that no government, no scientist, anyone could be able to inform or to reinforce the behavioral change and the habits that are happening in the communities. It needs communities themselves, it needs the individuals, because we are not there. So the issue of wearing a mask in public, the issue of the hand hygiene, the surface hygiene, the physical distancing and avoiding the gatherings and stay at home, that one has to be absorbed, and the community has to take responsibility. So today, as part of the behavioral change campaign with the community health workers, where we have conducted the door-to-door and also street-to-street, you will have seen that there have been many gatherings there. But unfortunately, we need also to understand that there are people who might actually not even have a means to have a mask. But as we say, that you can take your shawl, your scarf, and then you cover yourself. But we haven't seen such. So it's not only in Mitchell's Plain. You get some of these kind of the misbehaviors in all other parts. If you have been to the mall, again, you'll find that people are not wearing masks. So that's why we want to, as part of what we do as the government is about, we want to make sure that in the government facilities, no one must enter the building without wearing a mask, which is fortunately now it has been part of the regulations, national regulations. In the malls, the management must ensure that everyone who gets inside must wear a mask. But in the communities, no one will be able to police them unless they police themselves. So that's why when we're undergoing this door-to-door, we're wanting to make sure that not only as individuals, but the people like the anti-loners, for example, who are being known in the communities, they could be able to say, hey, when I can't, just put on the mask. So that's what we're trying to do, because at the end, people go to the clinics, to the hospitals because of the COVID. When these 5 golden rules have failed, we could be able to stop the spread when each and everyone takes their responsibility in terms of try to avoid your droplets when you are coughing, when you are sneezing, when you're talking, that they go elsewhere. Therefore, that's why you put a mask. And also that's why you have to wash your hands, so that in case that now the virus is in your hand, wash your surface using 6 spoons of a jig in a liter of water every 20 minutes in your house, so that you can be able to stop the spread. And for those who are going to the shops, they have to also observe shop etiquette where they don't touch everything, and they must sanitize also as they go out. You must avoid to hug your older persons and those who have got also comorbidities, because you could be able to take the spread. So that's why here it's part of the community behaviors, so that they can take their responsibility to stop the spread and save.
We come out of that conversation